Tell me if this scenario rings a bell. You're on the 11th tee. It is a short par 4, so you're excited. You got your driver in your hand, you got your buddies watching, egging you on, and you're telling yourself, come on, just put a smooth swing on it. You don't want to embarrass yourself. You start your backswing, you keep your elbow tight because you don't want a chicken wing and slice. You start loading onto your trail leg, and then you shift through to your lead side, and there it is again. That little stab or that deep ache in your knee that makes you tense up right before you hit impact. Now, it's not so bad that you quit. You don't have to walk off the course. You finish your round, but at some point between the 11th fairway and the 19th hole, that same intrusive thought starts to sneak in. Is this just my age, or is there something actually wrong in there? Well, for the last 20 years, golfers like you have mostly been told the same 3 myths about knee pain. Myth number 1 is that golf is low impact, so if your knee hurts this much, the joint has to be worn out. Myth number 2 is if the cortisone injections aren't lasting, the next step is surgery, or just live with it, right? And myth number 3 is that all knee pain is basically the same. We age, we get arthritis, and it is just what it is. Well, today I want to walk you through what reality actually looks like. My name is Dr. Gayan Poovendran. I am a medical doctor who specializes in sports and regenerative medicine. And for the last 15 years, I have helped thousands of golfers conquer their knee pain without resorting to invasive surgery. Now, by the end of this video, you are going to know the 4 real reasons that your knee hurts on the golf course and how our understanding has changed over the last couple of decades, and also what smart golfers are doing right now that most of the system is still not talking about. But before we get too far into that, if you want something that you can use before your very next round, I have put together a free 5-minute warm-up guide that is specifically made for golfers that have knee pain. I call it the Ready for Tee Off guide, and you can grab it right now at readyforteeoff.com. It is absolutely free. There are no strings attached, so just go get it and then come back. I promise, I'll still be here. All right, welcome back. Let's start with how we used to think about this and how the data changed the story. So 20 years ago, the default assumption was that golf was a low impact activity. All it was involved was some walking and some rotation, but it was nothing demanding like running or basketball or soccer or tennis or pickleball, right? It was considered relatively safe. If you hurt, the default answer was always, well, you're just getting older, it's just a little bit of arthritis. So what you should do is you should start riding the cart and you should take some anti-inflammatory medicines before your round. Then the numbers started to come in. So there was a large systematic review that was published in 2017, and it looked at golfers and golf injuries, and it found that knee injuries actually accounted for up to 18% of all injuries in golf, and older players were at higher risk. So in other words, knee problems in golfers are not rare. And also, it's not just happening to guys who are swinging out of their shoes. Knee injuries in golfers happen across handicaps and across ages. Now, that same review showed something else even more important, the lead knee. Now, for you right-handed golfers, that's your left knee. That lead knee is exposed to complex motions and high stress that looks a lot less like gentle exercise and a lot more like a power sport. There are compressive loads of up to 440% of your body weight that have been measured in the lead knee during your golf swing. So if you're like me and you weigh around 200 pounds, your lead knee might actually be seeing close to 900 pounds of force at impact. That's myth number 1 gone. Golf is not as low impact for your knee as you've been told in the past. So what are the 4 real reasons that your knee actually hurts on the golf course? Well, reason number 1 is the way that the modern golf swing loads your knee has changed, and your knee may not have kept up with it. Over the last 10 to 15 years, the modern swing has trended towards more power, more hip turn, more speed, more ground reaction force. Now, this is great for hitting the long ball and getting distance, but it's not always great for a knee that has some mileage on it. Studies that look at swing mechanics show that that lead knee moves from a flexed and loaded position like this to a rapidly straightened position at impact, all while that shin bone, the lower bone, is rotating inwards. So that twist under load is exactly what's stressing the meniscus and the cartilage on the inside of your knee. So if you feel that sharp catching pain on the inside of your front knee as you unwind, that is not just getting older. That is a very specific mechanical challenge that your swing is putting on a joint that may already have some wear and tear. Reason number 2 that your knee hurts on the golf course. We now know most golf knee pain is not just arthritis. It is a specific structure, and most people have never been explained which one. In that same era, MRI use exploded. So instead of just x-rays, we were able to start actually seeing what was happening inside the golfer's knee. And what started showing up over and over again? Well, it was meniscus tears, particularly the medial meniscus, and early arthritis of the medial compartment. Now, the medial compartment or the medial meniscus, it sits on the inside part of your knee. So if you touch your knees together, those are both your medial sides touching. One 2017 summary noticed that medial meniscus tears were the most commonly diagnosed knee injury in golfers, and then number 2 was joint pain from arthritis. Now, here's why that matters though. A meniscus tear, that shock absorbing pad in the knee that helps spread out force, that behaves differently than pure cartilage wear. It hurts in different patterns and it responds differently to load. And it responds differently to treatment. So lumping them together under "you have arthritis, welcome to your 50s," well, it's not just lazy, it's clinically wrong. Now, in my practice, when a golfer like you comes in and says, "Hey doc, it hurts right here on the inside of my knee," I don't stop at the word arthritis, because I want to know this. Is this meniscus? Is this cartilage? Is this tendon? Is it bone? Is it ligament? Or is it a combination of those? Because the whole plan, from what you do in the gym to what we consider in the procedure room, that depends on that answer. Reason number 3, the way we treated knee pain for years, it was built on speed and volume, not for you. So if you went to a standard orthopedic clinic at any time over the last 15 years, including when I used to work in one, your experience probably went something like this. You got a quick history, you got a quick cursory examination, you probably had an x-ray, and then you walked away with a couple of pieces of advice. It was some combination of these, or maybe one or more, right? Take this anti-inflammatory medicine before your round so it doesn't hurt. Oh, it's hurting a lot, so let's give you a cortisone shot. You know what? All you need is physical therapy. Or the best one was, look, your problem isn't bad enough for surgery yet, so come back when it is. But for the longest time, cortisone was the go-to, and I can see why. It calms inflammation, it helps with pain. It can give you short-term relief, but over time, the data made us much more cautious. Studies have shown that repeated cortisone shots actually accelerate cartilage breakdown, which means that it makes arthritis worse. What's worse is the benefit of cortisone is often short-lived. It's usually only a few weeks to a few months. Yes, I know we've all had that family member or the patient that says that a cortisone injection lasted them 10 years. They got lucky. It doesn't usually last that long. So cortisone injection is fine if you sprain something or you really need to get pain under control this one time. It's great to get through this acute injury, but it is not a long-term strategy for a joint, especially if it's a joint that you want to use for the next 20 years, especially if it's a joint that you're serious about avoiding a knee replacement in. This is one of the reasons that I stopped working inside the insurance system churn. When a system is made to force doctors to move patients through the clinic quickly, you start to only use the tools that fit the time and billing box and the path of least resistance, right? 7-minute visits, a quick shot that's covered by insurance, a quick physical therapy script, or a prescription of medication. However, when your only incentive is the patient sitting in front of you, the outcome of the joint that is sitting in front of you, you have to slow down. You get to slow down. You start to look at better imaging. You do a more complete physical exam. You talk to the patient more. You learn about their swing. You ask them what Saturday morning means to them. Then you build a plan around the person, not just their knee. Now, in my practice, I think of it as a knee restoration process. Step 1 is always diagnostic. Real history, real exam, real imaging, and a real conversation about how you're using your knee, including golf. Only then do we even start talking about biologics like PRP. And reason number 4 why your knee is probably still hurting on the golf course is we finally have tools that work with the biology of the knee, and most golfers have never had the conversation. Look, around the same time that we started realizing the limits of cortisone, regenerative medicine began to mature. Platelet-rich plasma, or PRP, went from some fringe idea to something that had an actual body of evidence behind it. Now, at the time, it started with tendon injuries, but it has now advanced to even mild to moderate arthritis. There are large reviews of knee arthritis that have been shown that PRP can reduce pain and improve function for many patients, especially patients that are in the early to moderate stages, and that's in a way that typically lasts longer than a cortisone injection, and again, with less long-term damage. So what is PRP? Well, in plain English, we're gonna draw some of your blood, we spin it and concentrate the platelets, which are the tiny little healing packets and the growth factors, and we inject that concentrated product right back into the part of the knee that's actually damaged. There is no foreign chemical here, there is no steroid. This is your own biology redirected to the correct address. Now, in my world, PRP is often the first regenerative step in the knee restoration process, especially for golfers who are not yet ready for the "we are seriously talking about surgery" stage. We can then layer on things later on, like very targeted strengthening, swing and load modifications, and sometimes adjuncts like shockwave or peptides help support healing and inflammation control from the inside. Now look, not every knee needs every single tool, but some needs, all they need is a better warm-up, or they need a more intelligent strengthening program. Some need a single round of PRP, some need a more aggressive plan. But here is the key. Without a real diagnosis, you don't know which knee you have. So let me put this all together for your world. If you keep doing what you have been doing, that means accepting vague answers or vague labels, just doing the quick shot that's the path of least resistance, accepting it's just age, well, then the most likely outcome is, well, more of what you're already seeing. The pain gets a little louder at each year. You start changing your swing to protect it. You start hitting shorter balls. You take the cart more often. You skip more rounds and you miss time out with your friends. And then eventually somebody in a white coat tells you, well, now it's really time to talk about surgery. So if you do it differently though, if you insist on a clear diagnosis, if you find a physician who actually understands sport mechanics and considers regenerative options like PRP early when they're still appropriate, you give yourself more of the good stuff. That means more years of real golf, more Saturdays with your buddies, a better chance of avoiding or at least delaying a major surgery. And just as importantly, you finally feel like the plan for your knee makes sense. Here is a behavior change I am going to recommend to you as a doctor, not as a content creator. Now remember, I'm not your doctor, at least not yet, but at your next appointment, or if it's your first appointment with a sports medicine physician, I want you to ask one simple question and then wait for the real answer. Ask the doctor, what exactly is damaged in my knee and what are my options beside pain medicines and jumping straight to surgery or a cortisone shot? If the answer is rushed or vague, or it sounds like a script because they have to go and see 3 more patients that are waiting for them, well then you've learned something really important about that practice. If the answer is specific, if it's your medial meniscus, or it's early arthritis on the inside of your knee, or it's a combination of those, and it's followed by a real conversation about mechanics and regenerative first medicine, well then you're probably in the right place. The conversation matters. In my practice, for the right golfer, that plan often includes PRP as the first biologic step. Now, it's not as magic, but it's as a way to change the biology of the joint while we also change the mechanics and the strength around the knee. Now, next week, I am going to do an entire video answering a question that you probably have already Googled if you have come across this video, and that's, does PRP really work for knee pain? I will talk about studies, I will talk about outcomes, I will talk about who it helps, and I will also talk about who it does not help. But that video only matters if you take this step first. Demand a real diagnosis. So here is your concrete clinical recommendation from this video. Within the next 2 weeks, I want you to do 2 things. First, your knee is hurting, stop waiting. Book an appointment with someone who actually does sports and musculoskeletal medicine, not just your primary care doctor, not even necessarily just an orthopedic surgeon. When you sit down, ask the question, doctor, what exactly is damaged in my knee and what are my options that are beyond shots and beyond surgery? Please do not leave that office visit without an answer that makes sense to you. Second, before your next round, put your knee in the best position you can with what you already have. Go grab that free Ready for Tee Off warm-up guide at readyforteeoff.com. 5 minutes on your phone, specifically designed for golfers that have knee pain. Now, it is not going to reverse a meniscus tear or arthritis, but it will get the muscles around your knee turned on, and it will also improve how you load the joint and give you immediate feedback on how much better your swing can feel when the system is actually prepared. Look, It's 5 minutes before you play, that's it. Your knee will feel the difference between standing on the first tee cold versus actually prepared. So if you have a guy in your group who is always rubbing his knee on the walk back to the cart, and he's joking about old man joints, send him my video. In my experience, the guys who joke the loudest are often the ones who have to have this conversation the most. I'm Dr. Gayan Poovendran. Now you know what most golfers never find out. I hope to see you next time pain-free on the fairway. Maybe at Pebble Beach, maybe at TPC Sawgrass, maybe at Torrey Pines, or how about St. Andrews? Which is the bucket list course that you want to play most? Tell me in the comments below.